Still on that health bit, Kenya requires 30.9 billion shillings annually to bridge the funding gap on various health programs following the stop work order by the United States government. The HIV program alone requires 5.24 billion shillings in the 2024-2025 financial year to cater for commodities as well as maintain the over 11,000 frontline healthcare workers to ensure continuity of services.
The implications of the stop work order by the United States government continues to be felt in Kenya, especially in HIV response, with 41,547 staff affected. Out of this number, 11,059 are frontline health workers who now require 3.9 billion shillings for maintenance in the current financial year. Another 1.2 billion shillings is required for distribution of HIV commodities in the current financial year. According to stakeholders in the health sector and governors who convened in Nairobi to chart the way forward, Kenya needs to scale up domestic financing and localize solutions for efficient service delivery to the over 1.4 million people living with HIV.
We have roads, we have other things, and we have health. We must say, what is it we are going to give priority?
Where is it that they can cut from, whether it's other sector health programs or whether it is in other programs like infrastructure, to bridge the gap so that we can say that we will be able to continue with providing drugs.
I am persuaded that this could be one of the best things that ever happened to us as a country. Because for how long were we expecting other countries, other taxpayers, to continue supporting very essential layer of health services?
We are engaging with other bilateral donors to anticipate and mitigate potential funding gaps. We have anticipated this shift. Following Kenya's reclassification from a low-income to a low-middle-income country, donors signaled an exit by 2030.
However, the session became heated, with the governors demanding to know why National Treasury Cabinet Secretary John Mbadi did not show up to provide answers on the proposed funding roadmap.
My role here will be to go back and advise my Cabinet Secretary on the discussions that have and the deliberations that have taken place.
Honestly, for the National Treasury not to turn up, even send their permanent secretary, or somebody who can, that's why I said, you must be able to give us an answer. For you just to come here and tell us you are going to take note, honestly.
Treasury has sent somebody who has no brief, who has no instructions. We have come here, we have sat for 3 hours. We have left our counties, it's raining, we should be distributing fertilizer and seed. We are here and you are giving us stories about notes.
If you look at this table, there are more than 9 flags that were flying today coming to this meeting. Then you have seen the kind of response we have gotten. I think that is not going to be allowed.
According to data from the Council of Governors, Nairobi County has the highest number of staff supported by the U.S. government, which stands at 8,803, followed by Kisumu with 3,759, Homa Bay 3,282, Migori 3,268, Kiambu 2,982, and Siaya 2,490. Nancy Okware, Prime Edition.